You've probably heard of diabetes mellitus before. Perhaps, insipidus is what sounds strange to you. In case you're asking, you should know they are two different unrelated conditions. Diabetes insipidus is one of the least common types of diabetes. It is an uncommon disorder characterized by fluid imbalance in the body. Apart from feeling thirsty all the time whether or not you've had a drink, this condition also causes the production of above normal levels of urine. The medical world is yet to find a cure for diabetes insipidus, but there are several treatments available that can help you manage the condition.
Welcome to Simplified Health Tips, your place for factual information about achieving and maintaining optimal health. I'm Michael. Today Russell and I will be covering everything you need to know about diabetes insipidus, including its causes, symptoms and treatment options. So, tap the like button, smash that subscribe button and let's go. Okay Russell, tell us a little more about diabetes insipidus.
A lot of organizations categorize diabetes insipidus as a rare condition due to very few cases recorded globally. In the United States, only 1 in every 25,000 people are affected. Medical studies have found that types 1 and 2 diabetes remain the underlying cause of constant thirst and excessive urination. A related condition known as central diabetes insipidus is characterized by a failure of the pituitary gland to release vasopressin, a hormone responsible for regulating bodily fluids. On the other hand, nephrogenic diabetes insipidus has to do with the failure of the kidneys to respond to vasopressin where secretion occurs successfully.
Thanks Russell, please go a bit more in depth about the symptoms of diabetes insipidus.
You should already have an idea of the major symptoms of diabetes insipidus. Extreme thirst and the production of large amounts of urine make the top of the list. There is also the preference for cold drinks and the urge to get up for a pee at night. As a healthy adult, your urine output averages 1.5 liters daily. However, a chronic condition of diabetes insipidus can see the average adult having a urine output as much as 19 liters, or 20 quarts per day, especially if they are drinking a lot of fluids. While the condition cuts across age and gender, symptoms may vary for children. An infant or child with diabetes insipidus is likely to exhibit the following symptoms: wetting the bed, high fever. Infants will have heavy, wet diapers. Loss of weight, delayed or stunted growth, difficulty sleeping, vomiting and constipation, among others. The main trigger that tells you it is time to see a doctor is where you observe excessive urination and constant thirst.
Interesting. So, what are the causes of diabetes insipidus?
Your kidneys play a key role in maintaining fluid regulation and balance in your body, that is when your system is functioning properly. Where the case is otherwise, your body's fluid levels are not balanced, diabetes insipidus can be said to have occurred. It is the kidneys that remove the fluids from your bloodstream and temporarily store the fluid waste in your bladder as urine. Breathing, sweating and diarrhea are other common ways the body excretes excess fluids. This excretion is supported by the hormone, vasopressin. I'll tell you how that works in a bit. Vasopressin is also called antidiuretic hormone, ADH, and controls the speed of fluids excretion from the body. ADH is created in the hypothalamus, found near the pituitary gland at the lower region of the brain. When this hormone is not secreted, diabetes insipidus can occur because body fluids regulation becomes impossible. Other times, kidney malfunction can also lead to the condition. The different causes of diabetes insipidus can be determined by the specific type you have. Primary polydipsia. This is primarily caused by excessive intake of fluids, leading to excessive amounts of diluted urine. It is also sometimes called dipsogenic diabetes insipidus. The hypothalamus has a thirst-regulating mechanism, and damage to this mechanism can also cause primary polydipsia. Schizophrenia and other mental illnesses are other causes of this condition. Gestational diabetes insipidus. This is a very rare type of diabetes insipidus that only occurs during pregnancy. Here, the ADH in the mother is destroyed by an enzyme created by the placenta. Central diabetes insipidus. A head injury, an illness, a tumor or a surgery can cause damage to the hypothalamus or the pituitary gland, which can result in central diabetes insipidus. There is also evidence that certain inherited genetic disease is also a risk factor for this condition. All of these can affect ADH production, storage, and release. Nephrogenic diabetes insipidus. This is a kidney-related condition. Here, certain defects in the tubules of the kidney can prevent it from responding to ADH. These tubules are the kidney structures that cause the excretion or reabsorption of water in the body. A chronic kidney disease, genetics, some antiviral medications, and other drugs like lithium can lead to nephrogenic diabetes insipidus. Other likely causes may include the results of an autoimmune reaction, which can cause damage to the cells that produce vasopressin. In some other people, the cause may not be known.
Please tell us about the risk factors this condition.
Unlike most other types of diabetes insipidus, which are mostly caused by diseases, injuries, or other unknown factors, there is a common risk factor when it comes to nephrogenic diabetes insipidus. When present during or shortly after birth, there is often an inherited, genetic, factor that permanently alters the kidney's ability to act on the urine and make it more concentrated. Men are more likely to have nephrogenic diabetes insipidus, but there have also been cases of women passing the gene on to their infants. Generally, there are complications of diabetes insipidus that may occur. These include electrolyte imbalance. Electrolytes are minerals, like sodium and potassium, in your blood that helps to maintain body fluid balance. Diabetes insipidus can lead to an imbalance in those electrolytes, causing symptoms like vomiting, muscle cramps, nausea, weakness, loss of appetite, and confusion. Dehydration. This is another common complication of diabetes insipidus. It can lead to fatigue, extreme thirst, changing skin elasticity, and dry mouth.
How is diabetes insipidus diagnosed?
Due to its often very obvious symptoms, it is quite easy to diagnose diabetes insipidus. Some diagnostic methods include genetic screening, which is suggested when there is a history of excess urination in your family. Water deprivation test is another common type of diagnosis. Your doctor will ask you to stop taking fluids for a number of hours under strict monitoring by healthcare personnel. Ordinarily, ADH steps in to prevent dehydration by causing your kidneys to reduce the amount fluids lost by the body as urine. Your body weight will be observed for changes, urine output and concentration, as well as blood levels of ADH will be measured. Where necessary, your doctor may administer synthetic ADH to aid the process. All of these are done to determine whether your body is producing sufficient ADH, and if your kidneys are responding efficiently. Magnetic resonance imaging (MRI) is a non-invasive way to diagnose diabetes insipidus. It can check for abnormalities within and around your pituitary gland. Detailed and clear pictures of brain tissues are created using a magnetic field and radio waves.
Okay. What are the available treatment options for diabetes insipidus?
As with causes, treatment methods can only be determined by the type of diabetes insipidus. For the common types, the following are usually recommended. For central diabetes insipidus, there are mild conditions that may only require increased water intake. However, if there is an abnormality in your hypothalamus or pituitary gland that is causing the imbalance, a treatment will be initiated by your doctor to address the abnormality. Oftentimes, it requires taking a synthetic hormone called desmopressin, meant to complement the inadequate ADH or replace it. It also helps to reduce urination. This drug can be taken orally, as a nasal spray, or by injection. It is important to take only the amount of desmopressin you need daily by paying attention to how much your body makes, as too much can cause water retention, which has serious consequences. There are several other drugs that can be taken to boost ADH in the body and treat central diabetes insipidus. These include indomethacin and chlorpropamide. For nephrogenic diabetes insipidus, whatever your doctor will recommend will be targeted at helping the kidneys heal. A low-salt diet might be a good place to start to reduce urine production. Taking enough water will also help with dehydration. Drugs like hydrochlorothiazide can also help by reducing urine output. Sometimes, the condition might be caused by certain medications. Talk to your doctor to find out if you may need to stop taking such medications. Primary polydipsia is another type of diabetes insipidus whose treatment is mostly basic, as simple as reducing the amounts of fluids you take in. If it is related to a mental condition, you will need to address that condition first as one way to reduce the symptoms of diabetes insipidus. The final type here is gestational diabetes insipidus. The most common treatment is administering the synthetic hormone, desmopressin.
As we wrap up, please share a little about how to prevent developing diabetes insipidus.
Apart from unknown causes, mental illness and heredity, common ways to prevent diabetes insipidus is by protecting the health of your kidney. Take just the right amounts of water and see your doctor if you notice unpleasant symptoms. Regulating your salt intake is another way to help your system maintain its fluid balance. If you do sustain a head injury or undergo a surgery, be watchful of symptoms that may suggest a malfunctioning of pituitary gland or injury to the hypothalamus.
Thank you again, Russell, for helping our viewers better understand diabetes insipidus. To our viewers, remember to share this video with someone who may benefit from the information. Also leave your feedback and topic suggestions in the comments section. See you next time.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.